couple Blazers. A few Blazers have missed some games this year. Dr. Desai joining us here for this segment to break down the injuries. Guys, he's a musculoskeletal radiologist. You know what that means?
He does great work.
Yeah. He went to school longer than the three of us combined went to school. Thanks so much, Doctor, for joining us. Really appreciate it.
Thanks for having me.
Let's talk about the injuries the Blazers are dealing with right now, specifically starting out with Robin Lopez and his broken hand. When you've seen the play taking place and the injury that he suffered, did the prognosis and the time he'd be out, that pretty much mesh with what the doctors were talking about when they first diagnosed it?
Yeah, so it's he broke a couple of his bones in his hand, the long bones. They're called the metacarpals. And watching the play, though, it doesn't seem like it's as serious an injury that it turned out to be. And even then, it sounds like they were able to, cast him, and it's just going to, allow the tincture of time to get that better. So it'll be, a few weeks in that cast, and that should heal. But looking at the injury, it didn't seem to be that bad. But when they X-rayed it, I'm sure when they saw those fractures, and it really depends what that looks like, if they need to do surgery or those types of things, and it seemed to be one of the less serious types.
Dr. Desai, with an injury like that and his hand being in the cast so long, what would be the, the atrophy of the hand, strength-wise? How long would it take him probably to get this mobilization back?
So one of the things we worry about with the, the casting is a little bit of stiffness. That's probably the biggest thing. As far as atrophy, the time that he's going to be in that cast is going to be a few weeks, so I wouldn't worry too much about that. He's going to be able to regain that. But once he's coming out of that cast, the mobilization and getting that stiffness out, that's probably the biggest worry.
Do you think long-term, doctor, in regards to that area, is that something where he's going to have to wear some type of protection on for a while when he gets this cast off, when he first starts to come back and get into a playing situation?
It may be helpful. It may even just for his confidence to know that there's something there. But, he's a young guy. He's going to heal pretty darn well. And I think it was more of just kind of a fluke injury. And sometimes you can't help those happen. And so it's just really making sure that it heals properly. So they'll follow up with imaging and make sure that symptomatically he's doing well. Once he gets back on the court, he should be fine, though.
Joel Freeland out a couple weeks with a shoulder strain, and he talked about it being an injury that he first suffered several years ago, a recurrence of this. Are you concerned at all when a guy talks about a recurring injury or an injury that crops back up so many years later?
Yeah, it's a little bit more concerning. They talked about him having a rotator cuff strain. So if you think of the rotator cuff, or that tendon is going to be like a rope. And so a strain, you have a spectrum of injury from a mild strain where that rope is stretched a little bit, maybe the fibers are partially disrupted, to, a partial tear or even a full thickness tear. Then those require, surgical interventions, those types of things. So if it's on the milder spectrum, he'll come back from it, but it's still a bit worrisome. So, the rest and rehabilitation are the keys to that.
We want to make sure that people could trust you for most of the segments, so we didn't tell them where you went to school ahead of time. You're an Ohio State guy, though, right?
Yes. Yep.
Yes.
Yeah.
So you're going down to the big game, correct?
5 a.m. tomorrow morning.
5 a.m. in the morning. And you're rooting for the Ducks, though, I hear, yes?
The Ducks are my 1A. I've been here for 7 years, and so definitely I've watched as much of them this year as. So it was. I kind of feel like I already won. And now it's just.
Oh, you didn't already win. Come on now. If your Buckeyes don't win tomorrow,
I'll be sad.
What he's saying is that third-string backup quarterback, third string, that's taking us to the national championship. So there's a
but that's not good enough, Jerome.
certain winning in that.
Yeah.
Because you guys expect to get there after your first two quarterbacks went down.
Oh, no, we went to I went out to the Virginia Tech game this year, and that was a long trip. Came back very sad after that, and I was calling for Coach Meyer's head. I was like, you got to get it. We got to get a coach in there. But obviously, I'm not a football coach.
Dr. Desai, your specialties, though, if people want to look you up, your specialties out there.
So we have a practice that we do musculoskeletal health. We do anti-aging, functional medicine. We really have gotten into a lot of the stem cell, PRP types of therapies for joint and sports injury and spine injury.
Where they take the blood, they rotate it around, add some...
spin it, and then we can actually harvest your own stem cells and use that to treat different injuries. And it's really the kind of the cutting edge of musculoskeletal care. And sometimes we can save unnecessary surgeries, and we've gone away from using a lot of the cortisone, which could be damaging to the tissues. And sometimes it's very helpful, but some of these other newer technologies can be as helpful, or especially in the long term, they can be more effective.
All right.
And what's the name of your office?
Oh, RestorePDX.
All right.
Look at you, professional over here.
We got a chance.
Hitting him up for the plugs.
I like that.
Dr. Desai, thanks so much for joining us. We appreciate the information. Still much more ahead here on Talkin' Ball. We'll go to Dallas, and Dwight James is still going to teach Lou Holtz a lesson. We'll also hit up the Mondo pad and break down a key play from this